Greetings and welcome to your final week. It's been a long time, hasn't it? But we're almost at the end. Um, what I want to talk to you about for this week is just go over some stuff in Chapter 15. Um, the Healthcare Common Procedure Coding System, or HCPCS, was developed by CMS to report services not usually found in the CPT coding system. HCPS, HCPCS codes typically describe services or supplies not usually considered professional services, such as durable medical equipment, drugs, uh, transportation, and other such services. They are used to report services when there's no CPT code to describe that service. The code is more specific than the CPT code, or if they're instructed to do so by the payer. Many of the HCPCS codes contain a unit of service as part of the description. The actual number or amount of the service provided is reported in terms of the designated unit of service. So, such as the unit of time and such. Now, to select the correct code, coders must use both the index and the tabular list. HCPCS codes consist of a letter followed by 4 numbers. The tabular list is organized into sections according to the letter in the first position of the code. Each section describes a limited number of types of services or supplies. And the shortest section has only 3 HCPCS codes, whereas the larger ones have hundreds of individual codes. A codes describe transportation services, and this includes emergency and non-emergency transportation, medical and surgical supplies, and even certain administrative services, whereas B codes will identify products and devices used for internal and parenteral therapy, which includes special foods and fusion pumps. Now, C codes describe services reported by hospital outpatient departments. These codes are not used to report professional services or hospital services provided to the inpatients. D codes are no longer included in the HCPCS code set. In prior years, these codes would have identified dental procedures. Dental codes are created and maintained by the American Dental Association. E codes, these will describe things like durable medical equipment, things like radiograph machines and large equipment like that. Excuse me. We also have G codes, which describe a professional service. These codes may be required by Medicare to report services, even if a CPT code describes the same service. These codes are used to report measures for the Physician Quality Reporting Initiative. Then we have H codes, which report alcohol and substance abuse services provided for by Medicare programs. J codes, these identify drugs provided and physician offices and other outpatient settings. Uh, they do not describe prescription drugs provided by pharmacies. K codes will report wheelchair equipment and other equipment for Medicare. L codes will describe orthotic and prosthetic devices, prosthetic arms and legs, uh, and things like that. We also have prosthetic noses and ears, and so it'll cover a description of orthotic and prosthetic. M codes identify certain medical services. Now, there are only 6 separate M codes in the entire section. P codes, one second here. Let me see if I can get that back. My screen just went blank on me. There we go. Lovely computer technology. P codes will describe pathology and laboratory services. We have Q codes, which report certain supplies. They may also include temporary codes for Medicare reporting purposes. We have R codes, which will describe transporting X-ray and ECG equipment to nursing homes and other facilities to perform tests. Now, there are only 3 R codes in this section. Our S codes are temporary codes used by commercial payers and Medicaid programs. Medicare doesn't recognize the S codes. The T codes report services for state Medicaid programs. They may be used by commercial payers but are not recognized by Medicare. V codes describe vision, hearing, and special language devices and services. The HCPCS code set contains modifiers that may be used with both your HCPCS codes and CPT codes. There are more HCPCS modifiers than CPT modifiers. So you get more modifiers with the HCPCS. Some modifiers describe anatomical details that are not contained in the CPT or the HCPCS codes. Now, these are such as specific fingers, toes, eyelids, and coronary arteries. You have other modifiers that provide greater detail regarding DME, such as whether the equipment is purchased or rented. Modifiers also indicate whether the equipment is purchased new or used. When you look at the HCPCS manual, you see that it includes 4 appendixes. Appendix 1 is your table of drugs and is used to locate the HCPCS codes that identify specific drugs administered by healthcare providers. They're not used to identify prescription medications from pharmacies. Excuse me. Appendix 2 lists the HCPCS modifiers. Then Appendix 3 is a list of HCPCS abbreviations and acronyms. Appendix 4 reprints some of the Medicare publication and guidance documents. I'm going to just sort of go also over one of the scenarios that you might have, and or not necessarily a scenario, but let you know that when you finish reading 16, you should be able to code the services and supplies described in short scenarios of healthcare encounters. Questions that you might ask yourself for all of the coding situations are: on what day or dates were the services provided? Where were they provided? Did the provider perform EM services? If so, which code describes these services? And are there any modifiers that are indicated? Did the provider perform any procedures? If so, what codes describe these services? Are any modifiers indicated? And how many units should be reported? Now remember, units could be time, it could be doses, anything like that. Are other services involved? If other services are involved, what codes describe those services? Are any modifiers indicated? How many units should be reported? Did the services include medical supplies, DME, orthotics, prosthetics, or other services described by HCPCS codes? Why were all the procedures and services provided? What diagnosis codes describe the patient's condition? Let's look at one. Scenario 1. A 23-year-old obese female presents to her gynecologist's office for her annual exam. The physician performs a pap smear and a pelvic exam. The patient states that she has not had a menstrual cycle in 4 or 5 months and complains of bloating and abdominal cramping. The physician performs a problem-focused exam, and the medical decision making is of low complexity. The physician has the patient leave a urine specimen for dipstick analysis and orders a pelvic ultrasound. So we pay attention to everything that's said in those. So, scenario 1, you notice, has a list of codes. It has a set, a B set, a C set, and a D set. So these are codes that you would normally use for that patient. So once you figure that out, now in addition to that, what code would the physician use to report the bloating and abdominal cramping? What code's used to report the service of the pelvic ultrasound, which is going to be interpreted by an employed radiologist? And what ICD-10 CM code best describes the scenario? So as you see, there's a lot of stuff that goes into just answering what's wrong, where is it, what did the patient come in for? Once the patient was there for that, was there anything else that was found? If there was, what was ordered for it? So you've got all of these things. You're on your way to being a coder. So code the scenario. Actually, I would go ahead and code all the scenarios just for practice. And remember that the questions that need to be answered as you review each scenario. So remember what you need to ask yourself and what needs to be answered. And don't forget to answer the questions following each of the scenarios. Just, think like a coder. Pay attention to detail and check and recheck yourself. It's been great having you in class and being able to um, impart a little bit of knowledge to you. Um, I think you're going to go out there and you're going to be a great coder. You're going to excel at what you've learned. And as I said, it's been a great pleasure. And I wish you a great life and good luck in your chosen career. Thank you.